Hi, I'm Dr. Nazakat Hussain. I'm a consultant in spinal cord injuries and a clinical director of Advanced Rehabilitation Center. Today, I'm going to talk about spinal cord injuries, briefly about their management, and the first MENA Physical Medicine and Rehabilitation Conference, which is going to be hosted here in October 2016. The MENA Physical Medicine and Rehabilitation Conference is first of its kind. This is a first meeting which is actually going to invite the different stakeholders for physical medicine and rehabilitation services in the whole region. So this is a very exciting opportunity for us to go out and talk about it and make sure that population in general is aware of the importance of physical medicine and rehabilitation, specifically in this area of the world. Physical medicine and rehabilitation is a new specialty in the whole world, and especially in this region. People who will mostly benefit from coming to and attending this conference will be physical medicine and rehabilitation trainees, doctors practicing in physical medicine and rehabilitation field, also therapists which are providing the therapy services in this specialty, including speech and language pathologists, physiotherapists, occupational therapists, as well as students in the field of medicine or in the field of physical therapy, in the field of occupational therapy, and other therapy services. It will also benefit for commissioners who are actually paying for the services, and insurance companies, as well as regulatory bodies and people from a management background to come and attend so that they know better about the physical medicine and rehabilitation. The awareness of this specialty is lacking at the moment in this region. Spinal cord injury is a very rare condition. The injuries to the spine can be actually divided into two bigger groups: spinal column injuries, which are injuries to the bony part of the spine, and the spinal cord injuries, which are injuries to the nervous tissue or the spinal cord, which is contained within the spinal column. So people can have either a combination of both, where they have a spinal column injury and also results into spinal cord injury, or sometimes they can have just a spinal column, which is a bony injury, but no spinal cord injury. Similarly, the other way around, people can have spinal cord injury without actually having a bony injury to the spine. Spinal cord injury, although it's rare, but it's a very, very significant injury, and it's a life-changing event for people who get it, unfortunately. The common causes of spinal cord injury are either traumatic, which is after an accident or a fall or something like that, or non-traumatic, where it can be because of vascular events, blood supply problems, tumors and infections, etc. I think the most important point in the management of spinal cord injury is recognition itself. It's very, very important for people who are attending the individual initially to recognize that there's a potential for a spinal cord injury. So anybody who's involved in a high-speed road traffic accident, or who has got a fall from height, or any high-impact injury, we should expect that the person can have a spinal cord injury. So we should always look for it, because many a times what happens is that the cord injury is not recognized initially, and which can lead to further secondary damage. So prevention is very, very important, or to limit the secondary damage is very, very important in the early hours of management of spinal cord injury. So I think the most important bit of information from this, from my lecture, would be that for people to always keep spinal cord injury on the back of their mind when they are diagnosing the patients with multiple injuries or high velocity trauma injuries. In this region, we have noticed as actually in the rest of the world as well, but because the specialty is new in this region, that people do not have a very good understanding of what rehabilitation medicine is. If this conference can actually inform the people better what rehabilitation medicine is, that will be a good achievement. Rehabilitation medicine covers much more than just a physical therapy, which most of the people believe it is. So it is a trying to take the person back to what they were before their injury or before their condition, and that involves multidisciplinary team approach. It involves physiotherapists, occupational therapists, speech and language pathologists, doctors specializing in pain medicine, doctors specializing in orthopedics and fixation of the spine, doctors involved in the neuropsychology of the patient. So it's a much broader treatment than just a physiotherapy. So if people can understand it better, and I think that would be a very good achievement from this conference. Thank you very much, and please join me in my topic, which is long-term management of spinal cord injury, in the first Physical Medicine and Rehabilitation Conference in Dubai. Looking forward to see you there.